Good afternoon. My name is Carlos Sanchez. I am the Public Affairs Director for Hidalgo County. We're going to have a very important conversation this afternoon with Hidalgo County Judge Richard Cortez. We're now in day 8 of his emergency order to limit activity in Hidalgo County. And we'd like to spend a few minutes talking to Judge Cortez to get a sense of where we are and where we might be going. Welcome, Judge Cortez. How are you this afternoon?
I'm doing fine. Thank you, Carlos. Good afternoon, everyone.
So I understand that you've come up with a 5-part response plan. I'm wondering if we could just visit what that plan entails and how it's going so far.
Sure, Carlos. The Hidalgo County response plan has 5 components to it. The first component is we needed to decide what type of controls would be necessary to respond to this virus. The second part is, of course, we needed testing and the personal protection equipment here in the county to be able to test the different people that would come in with symptoms. The third part would be, well, now that we have somebody that tested positive, how do we care for them? The fourth one, which we didn't start to really think about it until here recently, is we need an economic recovery plan. This has had a tremendous negative impact on employment, on household income, on businesses. So we want to make sure that to the extent we can prepare ourselves to recover, we want to do that. The fifth component is just the county operations themselves. We are over by close to 4,000 different employees here in the county. We carry very significant operations, the jail, the courthouse, to mention a few besides all our 4 precincts. So those are the 5 components of our response plan.
Let's dig a little deeper if we can. First, community control. What does that mean and how is it manifesting itself?
Well, the community control, of course, was intended to pass an order that would put us in the best position to limit the spreading of the disease. And on a few days ago, I issued the order. It was an 11-page order, and it's all with the intent is to limit the spreading of this virus. Today, we're reviewing that order because as all cases, you have unintended consequences, you have abuses, you can't properly enforce certain things. So we're reviewing all of the different components of the order to see if we can make it better. We can make it better for the people that it governs, for the people that it enforces it, and of course, to make the spread from increasing. So we're looking.
I'm sorry, Judge, before we visit the components we're reviewing, I wanted to just get an overall sense of whether you're pleased or not with the community response, particularly to the shelter-at-home order.
Well, no, Carlos, I think I'm seeing just a lot of people out on the road. I'm still seeing a lot of people that don't believe that shelter in place is the right thing to do. So I'm hoping that we get better at that. I'm hoping that as time goes by, we learn to live in these difficult times. I mean, how do you tell a group of people of 1 million who have been free to do anything they wanted to, within the existing laws, that they can't do certain things. They can't even go to work. They can't even go practice their faith. So these are difficult times. But I hope that everybody understands that this is a health emergency, and we don't want the disease to control us. We want to control the disease.
And it must be doubly concerning to you, Judge, that it is resulting in an economic impact. But it's a choice between, I guess, the economy and life at this point. Is it that the way to characterize it?
Well, sure. This is not unique to Hidalgo County. This is a global problem we have, and that's just the way it is. So we have to learn to live with it. I'm hoping that the action that we take, and with the cooperation of all of our citizens, the negative consequences of this disease will be for a short period of time, as opposed to a long period of time. Those areas and those countries and those areas that that really didn't take this serious are still suffering from it. The countries that took this very seriously, like Czechoslovakia was one of them, said, hey, this is a serious thing. We want to take every precaution possible. And the consequences of the disease has been less in that country than in other countries that didn't take the precaution.
So, Judge, the order was issued March 26th, so we're now in the 8th day. The intent was to issue the order for a 2-week period. We'll be approaching that next week. Do you anticipate a need to extend the order at this point?
Yes, no doubt that I'm going to ask the Commissioner's Court to extend the order past the 10th. This will be consistent with what the President wants to do, what the Governor is doing. And for sure, I know that our battle with this disease is going to extend even beyond April the 30th.
And along the lines of asking the commissioners to extend the order, are you looking at changing or modifying your current orders as they exist now?
Yes, we of course have been receiving complaints about what they would consider to be non-essential activities such as the golf course, no social distancing when people are going into grocery store and things like that. So we have 22 cities, and in order for us to have order in all 22 cities and along our rural areas in the county, I think we need to have a uniform order, a uniform law that would take all those things into consideration. So we're working on changing the language to the order to be more specific as to what these grocery stores that must be open, should be open, what procedures do we think would be appropriate in order to place the safeguards that we want.
Judge, as you know, governmental institutions, I've got reports from the media, are being overwhelmed by calls from the community about very specific cases with regard to, is this considered essential? Is that considered essential? Would you have a general rule of thumb for those who might be confused with regard to where we stand today?
Well, our rule of thumb is really common sense. If you don't have to be out, you don't have to do it, stay home. The federal government, through the Cyber Infrastructure Security Agency, came up with a list of what they define to be essential businesses. So when we started this order or placed this order in place, we were looking at that definition of essential businesses for purposes of our rule. It would be very difficult for me to argue in a court of law or others to take issue with the way that the federal government has identified an essential business. But again, this is our community. We decide for ourselves what is right, what is wrong. And one of the things that you asked me is to maybe possible future measures. We're thinking about, masks or anybody's outside, to wear some protection, over your mouth. And what this means to me, and what it would mean to anybody that would see you with one of these, is that person is telling you, I care for you. I'm not trying to protect myself. I'm trying to protect you from me spreading any virus to you. So we're looking at possibly doing that. One of the precautions that Czechoslovakia did and other areas have done is to require masking. So we're looking at that.
Well, and I guess when you talk about common sense, people are asking things that would seem almost trivial in nature, like, can I go exercise outside? What I'm understanding from you is at this point in time, it's probably wiser not to. Is that an accurate perception?
Carlos, I wish I had the answer to every question out there, but this is how I would look at it myself. The purpose of this order is to have social distance from one another, personal hygiene, and sanitation. So if you want to go outside, and exercise, walk, and do whatever you want to do, take those things into consideration. Don't touch things. Don't get close to people. Take all of those precautions. One of the sad things about the transmission of this virus is it can be in the air. It can be when you're least expected. So anytime that you really go outside your own environment, there is some probability of danger because you don't know where the virus is at any time.
Judge, the city of Laredo recently passed an order that requires everybody to wear masks while they're outside. Is that something you're considering?
Yes, I spoke to Mayor Science yesterday, in fact, because I wanted to know how that was doing. I would hate to impose things that are too onerous on people or not necessary for people. So he told me that they were very happy that they did that. You know, they've had 5 deaths in Laredo. We have had 0 deaths here in Hidalgo County. But yes, that's something that we're considering. I discussed it with the 22 mayors. We have a conference call every day with mayors, and I've alerted them that this is something that we're thinking. And I think very, very soon we'll make a decision whether that's the appropriate action.
Now, I know early on after your orders, there was a lot of questions about child care facilities and adult daycare facilities, and they were permissive at the time, particularly under state guidelines. But I'm wondering if that is something that's on the table with regard to tightening up a bit in the future with your new orders.
The answer is yes. The adult daycare centers, which are very vulnerable to this disease because they're dealing with elderly people, is something that we must look at. And of course, children. These are 2 areas that we are looking at and trying to make it better and trying to have a highest level of compliance.
The other thing that is a topic of discussion is travel restrictions. It's easy enough to say, let's implement travel restrictions, let's close down the airport. But logistically, I'm assuming that's quite a challenge from your perspective.
Carlos, well, thank you for asking that question. Of course, I mean, it's so easy to make a very radical change and says we're going to stop everybody from coming in to Hidalgo County. Well, we've got Highway 281. We've got the expressway coming in from Starr County and Cameron County. We have people that come and go from county to county to work and to procure goods and services and products and vice versa. So let's say that we did have a roadblock. Let's say we had a roadblock on both the east and the west side of the expressway. So now you stop the car. Now what? Okay. What do you do? Is the police officer, the law enforcement officer, what are they going to ask? What are they going to do? You're going to take their temperature. So these are things that we're looking into. I mean, I'm not going to say no to anything, but it's easier said than done. It's something that we want to consider. So when we talk about travel, I'd rather for people to say, look, if I need to travel somewhere, or I want to travel somewhere, don't, unless you really, really need to. If somebody wants to come and visit you, tell them, no, don't come to visit me. And certainly people from hotspots that are coming in to see you, take all those precautions. I mean, as this virus that we have here, as best as we know, it didn't originate here. Somebody brought it down here to us that had traveled to one of the hotspots.
Before we get into the second part of your 5-point plan testing, I'd like to just bring us up to date on where we stand with the numbers. Do you have a sense today of how many people in Hidalgo County have tested positive? And I know you're a forensic accountant by trade, so I know you look deeply at these numbers. I'm wondering if you could give me a sense of trends that you yourself are noticing.
Sure, I'll be happy to. The numbers that I want to give you would be as of yesterday. We had 635 tests to yesterday. 108 came from us, the healthcare department here, and 527 came from private labs or physicians. Out of that 635 tests, 79 were negative, or 13% of those turned out to be negative. 410, I'm sorry, not negative, positive. 79 were positive, which is 13%. 410 were negative. We have 146 pending. 0 deaths. We have 7 in the hospital, of which 4 of those 7 are in ICU. And my understanding is they all seem to be recovering. Recently, the University of Texas Rio Grande Valley started to provide testing. It is our understanding that the numbers that we know of as of yesterday, they tested 178 people and 5 of them came in positive. This 5 positive amount is not included in the numbers that I previously gave you. Surrounding areas in region, what we call region 11, which is pretty much south of San Antonio. Cameron County has 55, Willacy County has 5, Starr County has 5, Webb County has 65, and Nueces has 41.
So as of yesterday, I know there was 17 positive cases in a single day. The first day we had a single positive case. Can you give me a sense of how this exponential growth is happening and whether people should be concerned regarding exponential growth?
Yes, one of the things that we wanted to do is to have a benchmark so that we could use it as a planning tool. So how do you start making projections when you don't know the rate of infection? So when we first learned that there was an infection in Hidalgo County, we asked the University of Texas RGV to help us develop a model to do some projections. But what we did is we made some assumptions, and we basically said, okay, well, we know we have 1, but let's assume that we have 1 person infected in every city in Hidalgo County, which that would be multiplying times 22. So then we said, what do we think the infection rate is going to be? We said, well, based on history of other areas, and the range was anywhere, the multiplier was 3.3 to 1 or 1.1 to 1. So we went in the middle, we chose 2.2. So if you were to have an incubation rate of 7.1 days for that, then we did a projection. That projection.
So if I can interrupt, Judge, just because you're much better with numbers than I am. So what you're saying is for every person who is infected, the expectation right now is that they will infect an additional 2.2 persons. Is that accurate?
Yes, that they will infect they will multiply by 2.2 every 4 days, basically. Okay. That's what the formula is. That if you start with 1 and you multiply it times 2.2 and you compound it every 4 days, is going to double plus a little bit more. That's what the projection. Of course, these were just assumptions. So what do we have today? Well, if you look, we started off with 1, which was on February the 21st. Then when the order came in, when I issued the order, we were at 9. So he had already grown to 9 after 5 days. Well, then it went from 9 to 27 in 3 days, which is 3 times. Then it went from 27 to 62. Okay. And then it went all the way up to 79. So if you look at that trend, we went down to multiplier 1.4, better than 2.2, 1.6, better than 2.2, and if you take the last 4 days, then we're at 2. So based on the trend that we're seeing here of the numbers that we do know, we're at a 2 multiplier. It's still insufficient data. It's only data for 1 week. I think because the incubation period is 14 days. We don't know how many people were infected there, but by 14 days later, we have a pretty good idea what they are. So we're waiting for 1 more week's data, and I think we're going to be able to be a little more accurate in our predictions. But if you look at the projection that we did with the university on April the 10th, we would be projecting 704 people infected, positive. If we continue just the way that we are going with an increase, or 2 times increase, we would be at 316 on April 10th.
So medical experts have long been saying that this day is coming, and obviously they've been correct. Are they telling you to expect more cases over the next few weeks?
Well, yes. The hospitals themselves, we have different hospital groups here. They're planning, a surge, and they're making plans for this. And yes, we're all planning that we're going to have many more people test positive. Our hope is that we continue to have only 10% of those testing positive so far that need hospitalization. So that's good. So by the time that we get to a capacity problem, if we go into the next one of the next topics that we wanted to discuss as far as the care, it's been published. We have 78 ICU rooms. So if 10% of our people are going into the hospital and we need an ICU room, then we would need to at 780 people with positive would be kind of the trigger point as to possible starting to reach a capacity. So as you can tell, 780, even though that's a big number, and we're doubling every 4 days, we can be there by the end of the month.
So what you just described is my understanding of how the curve works. So we've heard this phrase many times over the last few weeks, the notion of flattening the curve. So as the number of people infected grows, it's approaching our hospital capacity. The challenge is to keep the number of infections beneath our capacity. Is that accurate?
That's accurate. Basically, the way that I can describe it is if you put it in a chart, there's a capacity for ICU beds, there's a capacity for ventilators, there's a capacity for ER negative pressure rooms, there's a capacity for certain things. Okay. So as you're growing in infections and growing people that need those services, if you pass that capacity, then we're overwhelming our healthcare providers. So what are we going to do with those people? We get into a real emergency. So that's why it's critical that we flatten the curve, meaning that it's not going to grow this way. It's going to grow this way, so we can stay underneath those capacity levels that we have here in the Rio Grande Valley.
So again, medical experts are advising you that the infection is here. What we're trying to determine now is how many are infected and at what rate, which is the $1 million question that we keep getting with regard to testing. Can you give us a sense of that part of your 5-point plan as it relates to testing?
Well, the good news is that we're starting to test more. I mean, just this week, tested, what did I say? An extra 178 tests by the University of Texas Medical School. So testing is important. But here's what I have to tell the people, because I know that they're very concerned. And then we have a very high percentage of indigent people here. If you feel the symptoms, okay, and you seek medical care, okay, and you don't get a test, what they're going to do is they're going to send you home, because if you're not symptomatic enough for them to warrant to send you to the hospital, they're going to send you home. So it doesn't matter whether you tested positive or negative. The procedure to care for you is the same. You go home for 14 days, and everybody in your home stays there for 14 days. The magic number is 14 days. So if you think you have this virus, okay, and you haven't been tested, and you feel like there's something going on, well, just go home and have everybody in your house stay home with you. Hopefully, we'll eventually get everybody tested so that you will know. But our recovery rate seems to be very good. The people that have gone into the hospital are pretty well coming out every 3 or 4 days. So that's been good news here. And for us to have 0 deaths, that's encouraging.
And at this point, because there is a nationwide shortage in tests, my understanding is there is no on-demand testing. So it's not like I can go up to a testing facility and say, I'd like to test myself and my family. There's got to be a protocol. Is that correct?
that's the protocol that we have. Of course, I can't speak for a private doctor or clinic. If a private doctor or clinic wants to test everybody, wants to come in there and pay, that's up to them. I hope that's not what they use, because I hope that we use it, properly and selectively. If I'm a family of 5 and I get infected with it, why waste 4 tests on my wife and 3 kids? The procedure is going to be the same. I'm going to be isolated, and so are they.
So yesterday, Hidalgo County Health Administrator Eddie Olivares said, because we're looking for more people with additional testing, we will find more people. Does that suggest that this is going to get worse before it gets better in terms of numbers?
Well, what's going to get worse or better is not going to be dictated by the test that we give. It's going to be dictated by the action that our people take. If they take this shelter in place seriously, and we do everything possible to keep the infection from growing, that's what's going to make this infection grow. It's not whether we test or don't test. The test simply just gives us confirmation that you do have the virus. So to me, what we must do as a community, we must follow these rules. We must stay at home, not go out unless we absolutely have to, practice personal hygiene, sanitize everything around us, and we're going to be fine.
And let's go back to point 3 of your 5-point plan, care. In addition to monitoring where we are with regard to the hospitals, is there anything else that you have, that you're considering at least, with regard to providing care for our community?
Well, all the hospitals are planning for offsite facilities and care. I know a couple of hospitals that are looking for another area other than the hospital to care for these patients. That's very good, and that's very important. As I said earlier today, that we have a very high amount of indigent care people. So we need to figure out, what are we going to do with them? Because some of these people, sometimes they may not be able to stay at home. I mean, they're going to need care somewhere. So this is part of the continuing learning process, continuing planning process that we have. Right now, our health department people, I mean, I love them to death. I mean, they've been working very, very hard every day. We've had over 5,000 calls to our call center. So we're doing everything we can to respond to the needs of the community as fast as we can. I just hope that everybody knows that that's what we're doing, and just be patient with us, that hopefully we'll get to where we want to be. We're close to it now.
And the objective that everybody seems to be working on is to get beyond this crisis period. But then we've got to deal with economic recovery. And I'm wondering if you could address that a bit and what your intent is on that front.
Well, absolutely. We need to get businesses back to be open. We need to get people back to work. We need to make sure that we qualify and apply for every federal and state assistance program that we have. Understand that today was the first day to apply for that Paycheck Protection Act, which I think is very good. So we want to be able to accumulate all of that data. I'm forming a committee, kind of a task force of prominent people in different industries, whether it's construction, banking, real estate, grocery, all those, and says, hey, let's get back, and what can we do together to put you in the best position to get back to work, like the restaurant industry. What can we do to get you back operational? We don't start thinking about these things now. I want to be able to move quickly in that recovery state.
And the final phase of your 5-point plan, county operations. Can you address that? Where do we stand now with regard to what Hidalgo County is doing for its residents?
Yeah, we've asked every department of the county to come up with a plan. And one of the things that we want is of course, to keep with the spirit of the order, and that is, social separation, sanitation. So what we're trying to do is to not make our lobbies and our places that do business to have more than 10 people, to have separation, always maintain cleanliness in there. So we're giving every department an opportunity to give us ideas as to how to do that. Our tax department, our tax collector department has been very active and very concerned because his people handle money and handle certain things. So he wanted to make sure that his workplace was safe. So he's taking some action and he's been publicizing that. Also our courthouse kind of a different situation because that's controlled by the Supreme Court of Texas. It's got separate set of rules. But if anybody has a hearing or some business at the courthouse, before you go there, call your lawyer. Make sure you call your lawyer. The lawyer tells you you have to be there, and then you have to be there. If the lawyer tells you you don't have to be there, don't go there, because that's also could be a hot spot. But all these things is, I mean, we're learning. I mean, these are things we had never been confronted with. So it's just we're learning. Hopefully, we'll do the best we can under very difficult circumstances.
And in closing, Judge, you're a man of faith, and you said often we're going to get through this. Can you reflect a little bit on that and elaborate your belief that we indeed will get through this?
Well, we will. It's my morning prayer, one morning prayer, and I'm always shocked sometimes when I read it. And my Lord's answer to me was, "How dare you ask me when this is going to end? Because it's not the time that it's going to end. I decide when it's going to end." And he further said, "What I want you, which I've always asked you, is to think of me and bring me into your decision-making process. And I will tell you when." So here to me, and we are a community of faith here. What did he tell us from day one? He says, "Worship me above all and minister to the needs of others." And if we do that, then we're gonna come in here stronger. When you see somebody with one of these, that somebody is telling you, "I love you," because he's not protecting himself, he's protecting you from him or her. So that's the type of community we want to be. That's the type of community I think we are. I wanted to bring this information out to you. I know it's been very difficult for many people. I know it is. And we take no pleasure in setting these controls for you. But we're hoping that because of the controls that we're putting in, because of the cooperation that we have with our people, this would be a short-term problem and not a long-term problem.
Are there any parting words you'd like to convey to the community, Judge?
Stay home and sanitize everything around you and care about somebody else. And when you go to the grocery store, when you go out, when you do anything, don't only think about yourself, think about the person around you. Together we can get this done.
And with that, we leave you. Thank you all for watching this Facebook Live with County Judge Richard Cortez. Thank you, Judge.
Thank you, Carlos.